The recent news that Matthew Perry died from an overdose of ketamine has stirred up a lot of discussion about the safety of using the anesthetic to treat anxiety, depression, as well as chronic pain. From all accounts, Matthew Perry had been self-medicating rather than going to the clinic that had originally treated him. And Charles Miller with Scenic City Neurotherapy says that is where the conversation really needs to focus. And he joins us this morning. So good to see you back.
I'm glad to be here.
I think it was kind of a foreshadowing almost tragically what just a couple of months ago you were on talking about this very thing, because word's out there about the benefits of using ketamine for a lot of people. And it's not required that somebody come to someone like you. But it's regulated, I guess, when they do, right?
Yeah, we're able to make sure that the administration is safe, that the dose is appropriate, that everything works the way it's supposed to, and that the patient gets to go home at the end of the day with no concern. It's what we see with this at-home use or self-administration. It's, I often say self-administration of anesthetics is historically a bad idea. This is something that we know in anesthesia, but the fact that it is legal for these large companies to send ketamine home with people doesn't mean that it's ethical or even safe. It just means that they haven't created a law to regulate it yet.
Can I play devil's advocate with you for just a minute? So there are probably a lot of people out there that have not even really heard much about ketamine, and now they have.
Yeah.
So if they've done some reading and they've done some even just headline reading, they're seeing some things like it was once intended to be used for veterinarian purposes and on. So that you could kind of quickly be jaded and say, how could it possibly be beneficial in any way, shape, or form? Do you get that?
Oh, absolutely, absolutely. Anesthesia, specifically ketamine, has been used in many different areas. There's been history of abuse with all anesthetics, because anything that makes you feel strange, people abuse. I mean, we had issues several years ago with people eating Tide Pods. So, it's like, this is like anything that will make someone feel strange, we always have a concern for abuse. In the case of ketamine, ketamine is a very diverse drug. It does many different things at many different dose levels. What we're using it for is to stimulate the brain's neuroregenerative process. We do that, we have to give it IV for this to occur. If we could do this in another way that was safe and effective, we would do that. Nobody likes to be stuck with an IV, but it is a necessary evil, the needle is. But our process is designed to produce the greatest efficacy with the highest level of safety and comfort for the patient. We make sure, my role being an anesthesia provider is to make sure that the administration is always safe and that the patient, leaves in no worse condition than when they arrived.
You were a nurse anesthetist before you began opening the practice, to the point that this is available in other ways besides coming to you. You're not going to be the person to throw anybody under the bus, I don't think, but not everyone is doing it with the background that you bring. No.
Unfortunately, if you're not competent to manage an airway, like if you're not anesthesia, emergency medicine, or have extensive experience in those two fields, you probably shouldn't be administering anesthetics.
You have extensive experience.
Yeah.
I learned this from a little bird, and you verified it for me, that at Scenic City Neurotherapy, y'all do more ketamine infusions. You're kind of sought after nationwide than anybody, and that you personally have administered more than anybody in the world. Is that right?
Yeah, and I was very surprised to find that out. It was one of the things as we all get together at our national conferences, everybody talks about, their numbers, and I'm just like, that's all you guys are doing. Okay. A lot of times it's a side piece of a practice. It's not the primary focus. It's like a psychiatry practice that does some ketamine infusion therapy. We are a dedicated ketamine infusion center.
I would challenge that, and I would say that you are a dedicated center for that, but you have this second focus of making sure that the mental health is covered. So you make sure that all of your patients are seeing a mental health provider. They're not coming in and just willy-nilly doing this.
No, this isn't a one-stop shop. This is one piece of a whole process. You have your psychiatrist, which the patient works with. You have your mental health provider, like a counselor, a therapist that they're working with. And then there's us, which we're dealing with the underlying anatomy of the mental health disorder. That's all we're dealing with. we're not fixing everything ourselves,
Right.
but we facilitate the patient getting well.
So a lot of what y'all see, I've learned over the years, is people who are dealing with anxiety and depression, PTSD. Chronic pain, though, is a big part of it.
It
So
is.
very often you're seeing first responders and veterans.
Yes.
And
yeah.
you have worked behind the scenes. I didn't know this until you came in today. I knew you helped veterans. I did not know you have been petitioning for a number of years now with the VA to get this covered. Elaborate.
And the VA is very passionate about making sure people are taken care of. It's just, I feel like they get a bad rap a lot of times because they are overextended. There's so few people trying to help so many. But what we've been able to set up with the VA is a veteran care agreement to where now we are able to treat all of our veterans with a VA referral at no cost to the veteran.
The only one that you know of in the country able to do this.
To the extent that we're able to, yeah.
So I would imagine there was an awful lot of vetting that had to be done.
It was a
Charles.
lot. It was a whole lot of work. We had an employee that was kind of their primary focus for the last couple years, was just to get this connection made. And she's done an amazing job, and we couldn't have done it without her.
Is it essentially an endorsement by the VA of the benefits of this? Treatment?
I think that we're figuring out nationally that what we're able to do with certain types of drugs called psychoplastogens is stimulate the brain to heal itself in many different ways. We treat everything from depression, anxiety to chronic pain to what we see with dementia, Alzheimer's, stroke recovery, traumatic brain injuries, because we're just creating an environment that's healthy for the brain.
When somebody comes to see you initially, are they going to leave with a treatment or will they just talk to you first?
No, it's a conversation. It costs nothing to talk. They come in, they sit down with me, and we answer questions. I get to know them and their background and see what their goals are and see if those align with what we're able to actually do. If it depends, we're not here to fix everything in your world. We're here to make you better at dealing with them.
So if somebody's watching and this time of year families are together and this comes up, if you are a veteran out there, what do you need to do?
Well, you can reach out to us and then we can do an initial consultation and then you can go to the VA and get your referral. Or if you already have a basic understanding, you can even go and get a referral before you do your initial consultation, and we'll reach out to you once we receive that referral.
But either way, in order to get it
fine.
covered complimentary, they have to get that VA referral.
It has to go through the VA process, but I know that at our local VA, they move very quickly and they're very passionate about making sure that people get help.
Okay. If somebody does want to come and have that initial conversation, is it okay for them to bring somebody else, friend or family, to
Absolutely.
listen
In fact, I think it's better. It's more ears, the better. It's it's a lot of information that comes at you in those in a single-hour consultation, and more two heads are better than one.
I think I have a little time, so before I let you run, in case I do have it, back to the Matthew Perry thing. None of us knows the definitive results, I guess, yet, but it looks like he was doing kind of street or mail order.
Actually, it's in all likelihood he was taking it not only, prescribed, but as prescribed. The problem wasn't, the initial article said he died of the acute effects of ketamine. The acute effects of an anesthetic is the goal of every anesthetic administration. That's what we want to happen. He died because of the acute effects of ketamine, combined with a drug called buprenorphine, which is an opioid agonist, combined with a hot tub.
So it was the combination.
It's the environment and no one there to take care of him. If he had taken that exact same dose in a facility, we could have managed him.
Okay.
It's kind of the difference. It's like it was the environment that was the problem. It was not the dose.
Well, here is how you will get in touch with Scenic City Neurotherapy, because if you are somebody who struggles with that kind of pain, mental or physical, it can be unsustainable at times, and so you don't want to have to wait to feel better. So at sceniccityneuroTherapy.com, their phone number 228-0579. That first conversation is just something to educate you and see if it's something you want to pursue.
Correct.
Great talking to you.
Always good.